I'm Chris Byrer. I'm a physician from the United States, and I'm the incoming president of the International AIDS Society. This is the 20th International AIDS Conference, the first one ever in Australia, and we're delighted that there's a very large participation from the Asia-Pacific region, but also from community.
My name's Rob Lake. I'm the Executive Director at AFAO. AFAO is the Australian Federation of AIDS organisations. Our national members include all of the organisations, National Association of People with HIV, of sex workers, people who inject drugs, and Aboriginal and Torres Strait Islander people affected by HIV. So the AAF is in essence a leadership program. As part of this 12-day program, people are travelling from Southeast Asia and the Pacific to a program which includes training and workshops on advocacy, media skills, lobbying, and as well as that, some of the broader issues around that will be key part of the AIDS 2014 conference in Melbourne. For us, it's a really important opportunity to be able to support the partners we work with in this region, but also to support them coming to what is a critical conference for the Asia-Pacific region in 2014.
I'm Roger Stanley. I am the president of the Samoa Fa'afafine Association, and our organization is based in Samoa and dealing directly with the needs of Fa'afafine and Fa'afatama.
I'm Jonas Bagas. I'm the executive director of TLF Share. It's an NGO on sexual health and human rights for gays, bisexuals, other men who have sex with men, and transgenders.
I am Ina Drandon from the Philippines, but I am based in Bangkok. I work with the Asia Pacific Coalition on Male Sexual Health, or APCOM.
My name is R.D. Marte, and I work at the Asia Pacific Council of AIDS Service Organizations, or APCASO. We work in a program that's funded by the Australian government called Community Advocacy Initiative.
My name is Vu, and I'm from Vietnam. I'm currently the network officer of Youth Voices Count, a network of young transgender persons and young MSM in Asia and the Pacific.
Hi, my name is Risitar Appa, and I'm the Secretariat for the Pacific Sexual Diversity Network, also known as PSDN.
Hi, I'm Putu Utami Dewi. I'm from Indonesia. I'm from Bali. I stay in Bali. I work in support group we are focused for people living with HIV/AIDS.
My name is Kim. I'm from Vietnam, and I am the network advisor, and I work for the Center for Supporting Community Development Initiative. It is a local NGO in Vietnam.
My name is Lalit, and I'm originally from Fiji Islands, and I moved in from Fiji Islands in 2006, and ever since I've been in Cook Islands. So Cook Islands is also a Pacific island, so there's not a major difference in terms of the climate, the atmosphere, so it's basically shifting back to another home.
Hi, my name is Patrick Johannes Lawrence, but you can call me Patrick. I live in Jakarta, Indonesia. I work in a Spiritia Foundation, the community-based organization that supporting of PL-HIV.
One of the main issues that APCASO is working on right now is making sure that investments on HIV reach communities, are based on evidence, and also work towards improvement of human rights.
The main issue right now is the growing HIV infection among men having sex with men transgenders and the persistence of stigma and discrimination against the LGBT community.
The issues of MSM and transgender that APCOM are working on are as follows. First, the quality of service of the health service providers for MSM and transgender. Second, increased amount of investment for HIV programs directed to MSM and transgender. High sustainable sexual health and human rights of MSM and transgender in Asia and the Pacific.
Sex worker and MSM and TZ, and also the people who is drug, they still get the stigma and discrimination from the community and also from the government.
The challenges is in Indonesia, it's right now for the just improving the involvement of people living with HIV/AIDS for the policy making.
ประเด็นที่ค่อยเห็นเวียกก็คือประเด็นที่หนึ่งก็แม่นว่าเรื่อง human rights.
There are a lot of issues that the Pacific go through, which I would say that they're sort of the same as Asia, but we have our own way of approaching them. Religion is very strong in the Pacific, and we do have to maintain that partnership with our religious leaders and our traditional leaders as well. But those are some of the issues that we will be addressing at the International AIDS Conference here in Melbourne, which will be happening next week.
Basically, challenges come in terms of funding, in terms of trying to negotiate, in terms of trying to work, in terms of trying to build partnerships with key stakeholders.
The main issues that I encounter are the human rights issue, and also the participation from the community is also an issue in my country, especially when it comes to decision making and policy forming.
There's no other way to go about it. If an HIV response is really to be effective, it really has to be centered on the needs and realities of community organizations and community networks. It has to have their involvement. If programs are to be scaled, there's no other way but to make sure that communities are mobilized to take part in providing the services and also in doing advocacy. There's a lot of things which governments, for example, wouldn't be able to access certain communities. Peer-based approach has been proven to be very, very effective. So evidence is there to tell us, communities, the experience tells us that it also works.
Well, studies show that although the HIV infection rate is decreasing in general, but it's actually going flat because certain populations are not being focused and are not being paid attention to enough. That is the young transgender persons and the young MSM, and because they're unreachable, although they are very vulnerable and very important in the fight against HIV.
A couple of the Pacific Islanders were talking amongst themselves that they felt that why do we need LGBT rights, where we've got the human rights, which we all come under that umbrella. But it's just that understanding of the level of human rights that they need to be aware of so that they can further advocate to their governments on the different laws that they have that discriminate towards them.
It's an important turning point right now for the Philippines in a sense that we've always been told and we've always been led to believe that LGBTs are accepted already. You know, HIV is not a priority issue because prevalence is low, and yet we're encountering the persistence of issues around HIV, around human rights violations against the LGBTs. And it's important to consolidate the community, gather our strength, work together and identify how we can engage institutions or government officials, and in a way we don't experience a backslide in human rights.
สำหรับอยู่บ้านข่อยสิ่งที่น่าเป็นห่วงที่สุดแล้วข่อยก็อยากเอาไปนำใช้ข่อยคิดว่าเรื่องมีเดียเรื่องการนำสื่อนำใช้ข้อมูลโซเชียลพวกมีเดียทั้งหลายนี่เข้าไปอยู่ในแคมเปญอยู่ในการเฮ็ดเวียกของข่อย
Khi mà đến Melbourne tôi được tập huấn, những cái khóa tập huấn như vậy thì tôi rất là mong muốn là khi mà quay về Việt Nam thì là học được về cái vận động chính sách, là làm thế nào để cho các bạn để dễ tiếp cận các dịch vụ y tế.
When I get more training, more knowledge, and very important to me from Indonesia, we are focused for the advocacy, social media campaigns. I hope I can run into Indonesia, specific in Bali. I would like to social media campaign, something like that, and how to advocate for the government.
I believe this is a place in which we can gather as much information and as much tools, methods, strategies for us to take back home and try to implement it in a way and try to put it in a way that fits our traditional setting or fits our own context in order for us to deliver a more specific message within our own country.
The thing that drew my attention to this Melbourne training plus the conference is how already being part of this fellowship, the program is dated leadership, human rights and good governance, which really is going to help me to bring back home, to push and to involve more with our community, to educate and to help them to understand, because that's the thing that we face back home. We share the knowledge just so that people are aware of the situation, people are aware of this existence.
What I like to see happening in the future in my country is the meaningful participation from the community and civil society into the decision-making process.
Well, I think we need, for me personally, we need more media exposure of, like, for example, you know, because drug user in Cambodia is like the bottom, like, you know, the bottom of the dirt or something like that, because they look at drug user. Perfect example, right? One lady, like I told a story about one of my clients, he was going through withdrawal, he need money. So he basically cut wires and sell the wire, the copper or the wire. So when he cut it, he don't know how to cut it because he seen somebody else cut it, so he cut it, he got shot, he got burnt. And then when I spoke to my neighbor about, you know, I didn't say he was a drug user, and she was like, oh, I feel bad. But then once she found out that he's a drug user, she's like, oh, I hope he died. That's what he get for stealing from people, you know? Like, I just want them to understand, drug user, they become a drug user because they're addicted. That's why, you know, they stealing and, you know, they need stealing and all that stuff to get the next hit. And I think a lot of Cambodian community, especially the community, don't understand, you know, why they're a drug user.
The challenge, I think, for communities, and what I hope people get out of this conference, is that they're going to have to change, as we've all had to change, our way of working, our way of doing business. It is critical now that community gain expertise, for example, in supporting people who are living with HIV and who are on antiviral therapy in adherence. That's going to be a critical role.
We always say that human rights is important or that the enabling environment is crucial, and yet conversations happening in the AIDS conference is disproportionate in favor of the biomedical interventions, and I think that has to stop. And it's very important for community advocates to speak up in order to have their voices heard, in order to, in a way, steer the conversation towards the other political and social engagements that have to happen in order to end the epidemic.